Activase, alteplase, is indicated for the management of acute ischemic stroke in adults for improving neurological recovery and reducing the incidence of disability. Treatment should only be initiated within 3 hours after the onset of stroke symptoms and after exclusion of intracranial hemorrhage by a cranial computerized tomography (CT) scan or other diagnostic imaging method sensitive for the presence of hemorrhage. See contraindications and the full prescribing information. All thrombolytic agents increase the risk of bleeding, including intracranial bleeding, and should be used only in appropriate patients. Not all patients with acute ischemic stroke will be eligible for Activase therapy, including patients with evidence of recent or active bleeding, recent within 3 months, intracranial or intraspinal surgery, serious head trauma, or previous stroke, uncontrolled high blood pressure, or impaired blood clotting.
Hello, I'm Jack Kessler, and I want to talk to you about stroke. Stroke affects more than 795,000 Americans every year. That's about 1 stroke every 40 seconds. Stroke is the leading cause of long-term disability in the United States. It is a devastating disease, and I should know. I suffered a stroke while on a fishing trip just a few years back. My brother-in-law called 911 immediately, and I was in the emergency room within a short time. I still vividly remember being wheeled to the CT scanner thinking, would I become a prisoner in my own house? The medical personnel at the hospital knew about Activase, were able to promptly diagnose and treat my stroke within 3 hours of stroke symptom onset. Indeed, it is good news that the neurologic impairment caused by a stroke may be reversed, and disability may be prevented. This video will help you to learn how and when to treat acute ischemic stroke with Activase. Because a stroke can happen to me, it can happen